We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and welcome to Doctors Are People Too. We have a very informative show tonight. I'm going to be talking to a general surgeon to start off the program. Dr. Werner Andrade is a general and bariatric surgeon here in South Florida, across mostly the Miami-Dade County. Dr. Andrade, how are you doing tonight? Welcome to the program.
Hello, hi, how are you? Good night. Thank you very much for the invitation.
And thanks for coming aboard on Doctors Are People Too. Can you tell me and the listeners a little bit about this Reshape integrated dual balloon system that you're now offering as a weight loss option?
Yes, at Hialeah Hospital, we are up to the technology. We have a new procedure that is the Reshape dual balloon. These are two balloons that are placed in the stomach. It's an alternative to lose weight. And the nice thing about this is that doesn't imply general surgery.
Now, this Reshape integrated dual balloon system, is this FDA approved?
Yes, it was recently approved by the FDA approximately 2 years ago.
And how long have you been performing the Reshape balloon system?
For almost a year. Actually, we were at Hialeah Hospital. We were one of the first hospitals to have this technology available.
Oh, wow. So you're right there at the beginning of this new procedure.
Yes, we want to offer a wide variety of procedures in our hospital that are up to date.
Now, before I ask you a little bit more about the actual system, the Reshape integrated dual balloon system that you just told us is FDA approved, did you have to be trained on this system?
Yes, you are totally right. You cannot just put the balloon. You need to go to a training before you start placing these balloons. For this, I went to Texas in order to get trained and get the certificate to start placing this balloon.
Now, how long was that training process?
It's like a whole day long, and it has two parts. The first part is that they give you education about the balloon. They give you all the didactics that you need for this, and the second part is hands-on. You train and do a simulation in maniquees on how to place these balloons.
Okay,
once you complete the process, you get certified for it.
I see. And then you said you went off to Texas for this certification, correct?
That's correct.
Okay, let's get into a little bit about more about the details of this Reshape integrated dual balloon system. I was reading up a little bit on it. And I know it's not everyone's a candidate for this surgery. So can you tell us a little bit about who is a candidate for this type of I shouldn't say surgery, procedure?
For the Reshape dual balloon, the best candidate for this procedure are patients who have a BMI between 30 and 40. That's the body mass index. And we're talking approximately 50 to 100 pounds overweight.
Okay, so this isn't severely overweight. This is more like you said, just 50 to 100 pounds. So this isn't, and I kept on saying surgery, but this is more of a procedure for someone who is 50 to 100 pounds overweight. It's not for someone that's over 100 pounds, correct?
Yeah, and you're totally right. And when I say BMI, that's the body mass index, that's the relation between the height and the weight. And you can calculate this in any computer or in any device. So for these patients who have a BMI between 30 and 40, and that's about 50 to 100 pounds of excess weight, plus that they have morbidities like high blood pressure, high cholesterol, and sleep apnea. These are the ideal candidates for this procedure. And you're right, it's not a surgical procedure. It's an endoscopic outpatient procedure.
Okay, we're here with Dr. Werner Andrade. He's a general and bariatric surgeon with an office in Hialeah and also an office in Miami with Tenet Florida Physician Services. Dr. Andrade is also the medical director of the bariatric surgery program at Hialeah Hospital and medical director of the bariatric surgery program at Coral Gables Hospital. So both. That's very impressive. Dr. Andrade's website is it's just Dr. and then his name Werner Andrade. So DrWernerAndrade.com, and his phone number is 305-691-0118. Dr. Andrade, is the Reshape integrated dual balloon system a non-surgical option? I know I mentioned a few times surgery because I'm used to saying your medical title there, general and bariatric surgery. But is this a non-surgical option?
Yes, you're right, and this can create confusion among patients. But I have to clarify that this is a non-surgical option to treat patients with morbid obesity. And what I'm saying not surgical option is that a lot of the patients prefer this because it doesn't imply any general anesthesia. And this procedure is ambulatory. That means that it's ambulatory outpatient. That means that you come to the hospital and you go home the same day, rather than being admitted in the hospital for 1 or 2 days, as we do with the surgical options.
Okay, so it's ambulatory. You go home the same day. Now, can you tell us a little bit of the process? I realize this is done endoscopically.
Yeah, that's correct. So if there is a patient that is interested in the Reshape dual balloon, the patient makes an appointment in my office, and we confirm that the patient is a candidate for it. Then after doing the physical examination and the assessment, we book the day for the procedure. Once the patient is booked for the procedure, they come to the endoscopy suite and is under sedation. Is not general anesthesia. Under sedation means that the patient is sleeping only. So the patient won't feel nothing, the patient won't remember nothing. And then I put a camera in the stomach. If the anatomy allows it, I deploy the dual balloon inside the stomach, and the balloon remains in place for 6 months. Then we remove it after 6 months.
Okay, how long does that process take you to insert the dual balloon? I know every case is different, but about how long are you inserting it, and how long, I guess, also until the patient wakes up?
This is the beautiful thing about the procedure. The procedure takes no more than 30 minutes. And the patient takes about 1 hour for the patient to be fully awake. Once it's safe for the patient is discharged home.
Wow, that is just amazing. And you said before that this is an outpatient procedure, so they're going home the same day.
Correct.
Now, is there a recovery time at home? I mean, should the person expect to take a few days or a week off work, just doing light things around the house? I mean, how does that work with recovery time?
Because this is an outpatient procedure, in theory, the patient can go back to work the next day. But the balloon has the possible risk to give the patient some nausea, so we give medications for that. And I recommend to my patients to return back to work, no restrictions, like about 1 week after the procedure. And I want to clarify that the program for the Reshape balloon is not 6 months. The balloon remains in place for 6 months, and at 6 months we remove it. But once we remove it, the whole program is 1 year. That means that the patients see our nutritionist on monthly basis for 1 year. So once we remove the balloon, we have a nutritionist that is coaching the patient to keep doing all the good habits that he or she has learned for the past 6 months to reinforce what has been learned.
It's just amazing that this process now. How does the actual balloons, the dual integrated balloon system, fill up the stomach and make it? Does it make it so the person doesn't want to overeat?
That's I think that everybody has been in the same situation when we have gone to a restaurant and we ate a lot, but so much that is uncomfortable. That's what the patients feel. They feel really, really full. So once I put the 2 balloons, okay, I fill them up with approximately 1 liter of fluid. So it occupies the space of the stomach. So this balloon acts by 2 things. Number 1, it gives you that feeling of being full. So it decreases your appetite. And number 2, causes restriction because this balloon is occupying most of the stomach. There's no space for that much food.
Now, can you also share a recent story of a woman who had the balloon procedure done and has lost 50 pounds? I mean, I know you can't tell us too much about the woman, but maybe a little bit about the story.
Oh, yeah, this is a very very happy and successful story. Recently, I removed her balloon, and the patient has lost close to 50 pounds. She's very, very, very happy, and she can tell the difference. She looks great, she feels great, but she realized what is the reason why we do this balloon. We don't do it for how good they feel. We don't do it for how good they look. We're doing it for one reason, for health, to recover your health. She's very happy with this, and now that we remove the balloon, she will be seeing our nutritionist for another 6 months to reinforce what she learned.
Just amazing. And was that was done at Hialeah Hospital?
Correct. You mentioned, and I want to say that I'm very proud to be the director of the bariatric surgery program at Hialeah Hospital. We have worked very, very hard to make of this one of the best bariatric surgery programs in the area. And as I told you, we always want to be up to date with the technology. And we are one of the very few hospitals in the Miami-Dade area that offers this procedure.
Now, Dr. Andrade was just mentioned Hialeah Hospital. Their website is hialeahhosp.com. That's Hialeah and then HOSP.com. They're located at 777 East 25th Street and Suite 420 in Hialeah. Oh, no, that's actually Dr. Sorry, I that's not correct. HialeahHosp.com, and Hialeah Hospital is located at 777 East 25th Street in Hialeah. Now, correct. Thank you. I was reading too much there. Thanks for telling us so much about the Reshape integrated balloon system. I know you have some other areas of interest, so I want to ask you a little bit about what types of minimally invasive laparoscopic surgery do you perform?
So, as I told you, we offer a wide variety of options to lose weight. One of the options is the Reshape dual balloon. That, by the way, I just want to say one last thing about the dual balloon. In Hialeah Hospital, we put the dual balloon because I think it's a better option. Because it's 2 balloons, it flexes more in the stomach and gives less discomfort. Do you know what I mean? And the other option that some other centers put is only 1 balloon, so it cannot flex that much and can provide more discomfort. Besides the Reshape dual balloon, that is a non-surgical option. In Hialeah Hospital, we offer surgical options to lose weight. The candidates for this procedure are patients who have a BMI of 35 or more. We are talking about 75 pounds or more of excess weight. Okay? And the procedures that we offer at Hialeah Hospital are, number 1, lap band. Number 2 is sleeve gastrectomy. Number 3, gastric bypass. And number 4, we offer revisional bariatric surgery, in which we can change one procedure to another if the patient didn't lose that much weight.
Oh wow, I didn't know that. You can change one procedure to the other. Oh, that's amazing.
Exactly. Hmm.
Now,
Yeah,
go ahead.
for example, if a patient had a lap band and lost some weight, but it didn't lose as we expected, the lap band can be switched to a sleeve gastrectomy or to a gastric bypass. And the sleeve gastrectomy can be changed and converted to a gastric bypass.
Now, can you explain starting with the lap band for us first, how that works?
Exactly. Just before that, I want to tell you that the bariatric surgery is very successful. It's successful up to 90% of the cases. For that 10% that regain some of the weight, we offer the revisional option. But let's talk about the lap band. The lap band is one of the easiest and safest procedures that we have for weight loss. The ideal candidates are patients who have a BMI between 30 and 40, so that means that they have morbid obesity, but they are not that overweight. This procedure involves to put a silicone band at the beginning of the stomach in a way that you create a new little stomach. This band is connected to a tube, and this tube is connected to a port that goes underneath the skin. The patient comes to the clinic every 2 months, and I add some saline, some fluid into the port to tighten up the band until the patient feels full every time he or she eats. Even that this is one of the safest procedures, the weight loss is not that significant. If a patient has 100 pounds overweight, you're expecting that the patient will lose about 30-40% of this excess weight.
Okay, so 30 or 40 pounds.
Exactly.
Now, what about a sleeve gastrectomy, or other known as the gastric sleeve? What is that?
Good point. Actually, and I just want to make emphasis that that's the reason why the lap band placement is decreasing among bariatric surgeons. But among bariatric surgeons, the most popular procedure nowadays, and the one that is most commonly performed in the United States, is the sleeve gastrectomy. The sleeve gastrectomy, I love this procedure. It's very safe and very easy to do if you know how to do it. And I'm saying that it's very safe because new studies have shown that this procedure is as safe as removing a gallbladder. And gallbladder is one of the safest procedures that we have in general surgery. And the sleeve gastrectomy is done very, very fast. In about 30-45 minutes, you're done. What does it imply? This is done under general anesthesia and minimal invasive. When I say minimal invasive, that means that it's tiny little incisions, and with video camera, you reduce the size of the stomach. The stomach is like a sack, and what you do is that you cut the stomach in a way that you leave it the exact same size and shape of a banana. And David, this is funny because some of my patients come to my clinic and they say, "Doctor, I want the banana procedure," and I know exactly what they're talking about. So the thing is this procedure works because it reduces the size of the stomach and the patient gets full faster. But one of the nicest things about this procedure is that part of the stomach that I remove produces a hormone called ghrelin. Ghrelin is the hormone that stimulates the appetite. So once I remove the stomach, the ghrelin levels decrease and the appetite goes all the way down. And I tell my patients that they will feel that it's not the food controlling them, but now they are in control of the food.
That's amazing. That's very visual with the banana there. So that really helped me out. I'm a visual person, so I think that's a good example to use. Now, let's talk a little bit about gastric bypass surgery. Can you explain that for me and then also the listeners?
Yes, the gastric bypass is a more complex procedure. This procedure has a little bit of more risks than the sleeve gastrectomy and takes about an hour or so to perform this procedure. What do? You cut the stomach at the very beginning of the stomach, leaving the stomach the size of the fist or less, okay? And you separate the two portions of the stomach, just leaving a small stomach. And then you cut the small bowel downstream, and you connect the small bowel to the tiny little stomach. So the gastric bypass continues to be the procedure that will make you lose more weight than any other procedure, but it has a little bit of more risks that the gastric sleeve and takes longer to do. But with this procedure, you will lose the weight whether you want it or not. How does it work? When you eat, you get full faster. But not only that, some portion of the small bowel does not absorb the nutrients. So the patient loses weight by two forms, restriction and malabsorption. I usually do the sleeve gastrectomy in patients who like to eat a lot of food. They constantly eat, or they eat large amounts of food. And for patients who have a BMI approximately from 35 to 50. But when I have patients who are really, really, really overweight, with BMI more than 50, I'm talking like about 200 pounds overweight, okay? I prefer to do the gastric bypass because it's the one that is going to make them to lose the most weight. And I also like to do the gastric bypass in patients who are addicted to sweets and have a lot of overweight, because with the bypass, if you eat a lot of sweets, okay, you will have an explosive diarrhea, you will have tachycardia, you will start sweating, and that's called dumping syndrome. So the next time that I go to you and I tell you, do you want some ice cream? The patients are like, no, I don't want to see ice cream anymore.
Oh, I see. Yeah, they definitely, they remember from last time.
Exactly.
Now, doctor, I only have a couple more minutes. What types of we talked a lot about bariatric surgery, and thank you so much for explaining everything. What types of minimally invasive laparoscopic surgeries do you perform?
Oh, it's, I'm glad that you brought that up. My practice is half general surgery and half bariatric surgery. And I love all of them because they are done minimally invasive. Minimal invasive is with video camera, so the patients recover faster and is with tiny little incisions. From the side of general surgery, I do what is gallbladders, patients who have chronic cholecystitis, the patients who have gallstones. And the beautiful thing is that I can operate patients that have gallstones, open, laparoscopic, single incision through the belly button. That means that only with a 2-centimeter incision in the belly button, I can remove the whole gallbladder. I can do it robotically and single incision robotically. So I'm very blessed to have a great preparation, a great training in laparoscopic surgery. I do a lot of hernias, umbilical hernias, groin hernias, small bowel and large bowel surgery, and also hiatal hernias. These are patients who have the stomach partially going into the chest, and that's giving them a lot of reflux. I do that too laparoscopically.
Wow, unbelievable. It's hard to believe, but we're almost out of time. Let me ask you, what are your hobbies and passions in life outside of medicine?
Besides surgery, because I really like what I do, I like to do exercise. I like to go to the gym almost on daily basis, and one of my passions is to play golf. I enjoy playing golf a lot.
Oh, nice! I didn't know that. I always like that question because you always learn a little bit about the doctor you didn't know. So that's really neat.
Yeah, it's a nice hobby.
Dr. Andrade, thank you so much. I just want to give out your info one more time. I blew through a commercial break, so I'm kind of running out of time, but we're here with Dr. Werner Andrade. His office number is 305-691-0118. He's with Tenet Florida Physician Services and the medical director of bariatric surgery at Hialeah Hospital, also on staff at Coral Gables Hospital. and it's very easy website, drwernerandrade.com. That's DR like doctor, and then his name, WERNERANDRADE.com. Dr. Andrade, thank you so much for the time tonight. I look forward to having you on the program in the future.
Thank you so very much. It was a pleasure. You have a great night, and good night to all our audience.
Thank you.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond, and welcome back to Doctors Are People Too. March is Colorectal Cancer Awareness Month, and we're lucky to have on the program tonight a colorectal and general surgeon, Dr. Roger Pons, nice enough to join us tonight. Dr. Pons, welcome to the program. How are you?
Thank you. Good. Thank you, Dave. Thank you for having me. Thank you very much.
And thanks for coming aboard on Doctors Are People Too. Now, you perform transanal endoscopic microsurgery. The acronym easier is TEM. Now, what is TEM and how do you perform this microsurgery?
That is done through a resectoscope. It's called a proctoscope. It's basically like a small tube, and it's done through the rectum using instruments, more or less like a laparoscopy. We use a CO2 insufflation of the rectum and remove lesions that are within the rectal area that are not very far away from the anus, about 10, 12 centimeters. So usually it gives the patient a faster recovery. There are not that many lesions that are possible that way, but when you get one like that, it's a good way to do it.
Now, and this is effective, this TEM procedure is effective in the treatment of non-cancerous and early stage rectal tumors?
Yes, early stage rectal tumors and benign lesions. That's really the best category that we like to do that.
Now, because this is a microsurgery, Is the TEM procedure less painful for the patient than, say, a traditional open surgery that was maybe done, a few years ago or decades ago?
Yeah, of course. This is what is considered minimally invasive, which is basically not using any incisions, and it's done through the rectum. There's some, discomfort involved because you have to dilate the anal opening and so forth. But as a rule, there's much less discomfort than the traditional surgery.
Now, talking about the traditional surgery, I just want to explain for myself and the listeners now, was the only option for this type of treatment traditional surgery before this TEM procedure, and is the traditional open surgery, it's done through a large abdominal incision, is that correct?
Yes. It can be done through a large abdominal incision, or it can be done laparoscopic, depending on the location of the lesion where the tumor is located. But definitely is more invasive when you go through the abdomen with incisions. That's right.
And we're here with Dr. Roger Pons. He's letting us know a little bit about the TEM procedure, which is minimally invasive treatment for non-cancerous and early stage rectal tumors. Dr. Pons, this TEM procedure, it obviously, because it's minimally invasive, will it result in less hospital time for the patient?
Usually 1 or 2 days in the hospital is the usual average, where the patient can manage the initial pain, and then they go home within 24, 48 hours if everything, goes well and there's no problems with any active bleeding or anything like that.
Wow, that's really quick. That's amazing. Now, compared to, say, if this was done with the traditional open surgery, what would be the difference in time? So you said 1 to 2 days with the TEM procedure, but if it was done with a large abdominal incision, what's the difference in time?
Well, they usually will spend at least a week, 7, 8 days in the hospital when you have an incision and abdominal pain, and the patients develop ileus, which is slowing down of the intestines and so forth. So it's definitely a much longer recovery time.
Wow, that's a big difference. And do people who have the TEM procedure typically have to wear a colostomy bag?
No, that's not usually not an issue, because there's no cutting involved on the outside of the bowel. It's all done through the inner portion of the rectal lumen or the wall. Yeah, there's no colostomy. No.
Oh, that's great news. Definitely. How long have you been performing the TEM procedure?
We started doing it around 2006. Haven't done a few of those, and they're sporadically, but on and off, we get a few of those every year.
Now, and you perform them at Tenet Hospitals. Is it Hialeah Hospital?
At Hialeah, yes. Uh-huh.
And you're also on staff at Palmetto General Hospital as well, too, correct?
Yes, I'm a Palmetto, too. Huh.
Now, why have most people not heard of the TEM procedure?
Well, it's not many centers in the country doing it. There's involved in the process of the preparation of the patient. You have to have a special equipment. So a lot of people don't want to spend the time, and they don't have the equipment to do it. So they have other options using what they call CO2 insufflation in the rectum with laparoscopic instruments, which is an alternative of that. But you need to have a specialized equipment for that, and dedication to commit to do it.
And you perform this TEM procedure at Hialeah Hospital?
Yeah, we have the machine at Hialeah Hospital. Yes, sir.
Okay, I just want to give out their info. It's hialeahhosp.com. That's HIALEAHHOSP.com in Hialeah. Now, if you want to find out a little bit more about the TEM procedure, Dr. Pons wrote an article, a blog article on it that can be found at tfpsdocs.com, where you can find Dr. Pons' profile, and you can click on the blog link there, and it's a really good article. It's actually something I've read a few different times to learn about this procedure. because I'm fascinated on the way medicine is moving nowadays and how this has cut, the recovery time down and less pain and et cetera. Now, I just want to give out Dr. Pons' info. Dr. Roger Pons, colorectal and general surgeon. His number is 305-696-0001, and his Hialeah office is with Tenet Florida Physician Services at 777 East 25th Street, Suite 420 in Hialeah. Now, Dr. Pons, it's very timely to have you on because March is Colorectal Cancer Awareness Month. And I know there's a lot of information out there about when to get a colonoscopy, but I wanted to ask you, starting with an average person with no family history of colon cancer, should they be thinking about talking to their doctor around the age of 50 for a colonoscopy?
That's correct. The American Cancer Society recommends colonoscopy screening at the age of 50. Even without symptoms. Obviously, if the patient has any type of symptoms, that should be done earlier. This is also with patients that have no history of colon cancer in the family, because that is something that is taken into account. If the patient has a first-degree relative with colon cancer, then the colonoscopy should be done about 10 years before the age of onset of the family member.
Oh, so if they have a first-degree family member, it can be done as early as 40?
It can be done as early as 40. The colon cancer was detected at 50, yeah. Usually 10 years before the index cancer in the family is the recommended time to do it.
Wow, I didn't know that. So that's something that obviously people should be going to their primary cares and, talking about family history. But if that's the case, first degree, they need to be maybe referred to a colorectal and general surgeon to have a colonoscopy. Let's talk a little bit about a colonoscopy. As a colorectal surgeon, what are you looking for during a colonoscopy?
Well, usually we try to look for polyps and lesions that are unusual, but polyps is the most common now. Most of the colon cancers now arise from polyps, and that's why by doing polypectomies, we hit on the incidence of colon cancer, and that's why a lot of times we're seeing now a trend in the decrease in colon cancer due to the fact that a lot of people are getting their colonoscopies done and getting their polyps removed.
Now, for people who are at an average risk of colon cancer, I guess this would be in between the 10-year screenings. Is a digital examination and fecal occult blood tests maybe all that's needed for screening?
Yeah, if there's no history and there's no symptoms or any other of the classic signs, then digital examination. Now, usually the patient has any type of positive blood in the stool or things like that will change it. But the average, usually, depending on the findings, is between 5 or 10 years. Most of the insurance don't want to approve colonoscopy less than 10 years, but if the patient has had polyps or anything, then that should be done earlier.
Now we're here with Dr. Roger Pons, colorectal and general surgeon with an office in Hialeah, right next to Hialeah Hospital. His number is 305-696-0001. I got another two-part question for you. Sorry to hit you with the two-part questions, but is it true that colon cancer starts as non-cancerous polyps, which can be removed while still non-cancerous?
Yes. 99% of all colon cancers are what they call sporadic, are from polyps, come from polyps. Now, there is also about 5%, 95% of the colon cancers are sporadic, 5% are the colon cancers that are inherited. So the most of the majority of colon cancers will arise from polyps.
And how are the polyps removed?
Endoscopically, depending on the size of the polyp, we can use snares, which are wires, and remove them and put them in baskets, send them for the pathology, or using little biopsy forceps, which are little tiny alligator type jaws, and then you can cauterize, burn, and thin the polyps also. So it depends on the size of the polyp. There are different modalities that you can use to remove the polyps.
Now, what are your prevention tips to prevent colon cancer, colon or rectal cancer?
Well, obviously, the problem that we have in this country is that we eat a diet low in fiber. So the recommendation is to eat a diet high in fiber, at least 25, 30 grams of fiber a day. Also, try to avoid the ingestion of meat that is undercooked, especially the ones that are done on the barbecues on those beautiful weekends that we like to do that. But that's been proven. That shows some incidents of carcinogenic ingestion. And also exercise and avoid smoking. Those are the usual tips that we tell the patients to try to prevent colon cancer.
And you can find these prevention tips on another article that Dr. Pons wrote, another blog article for March's Colorectal Cancer Awareness Month. Can be found at tenantfloridaphysicianservices.com, or if you just want to type in tfpsdocs.com, that's tfpsdocs.com. Click on Dr. Pons' profile or the B at the bottom of the page, and you'll find his latest blog on March's Colorectal Cancer Awareness Month. Dr. Pons, I have just a few more questions for you. Another one of your areas of interest is sacral nerve stimulation. I did a little, I got to be honest with you, I didn't know what this was beforehand. I had to do some research. So what is sacral nerve stimulation, and what types of ailments is it used to provide treatment for?
Yeah, well, that's used for patients who have fecal incontinence, which means that they have leakage of stool. And usually when they have like nerve damage in the sacral area that are related not to the injury of the muscles. So we do testing in the hospital. We have a lab, we do testing in the hospital, and we detect they have nerve damage. This is done as a two-stage procedure where we actually put some electrodes, wires inside the spinal cord in the back, usually around the sacral nerve, and then permanent implantable modulator that is adjusted and put in one of the pockets in the buttocks. That's used to control the fecal incontinence. We're very effective on patients that are incapacitated with fecal incontinence.
Wow, that is really interesting. I didn't know anything about that, so I'm glad you explained that. Just one other thing I want to ask you about now. Do you perform robotic colorectal surgery and also robotic abdominal hernia repair?
Yeah, we do both, and laparoscopic as well, depending on the case. We do have robotic capabilities in the hospital, and usually, depending on the case, we can do it either way, laparoscopic or robotically.
And robotically is obviously is minimally invasive as well, correct?
It's minimally invasive as well. That's correct. Yes, sir.
I just want to ask you, what are your hobbies and passions in life outside of medicine?
Well, like everybody else, I like to enjoy my family. I do exercise, jogging, and I do shooting. Sometimes I go to the range and competitive shooting, but I just try to spend as much time as I can with my family.
Oh, that's great. I always love that question because you always get a great answer. Dr. Pons, thanks so much for coming on the program. Doctors Are People Too. I'd like to have you on in the near future again.
Thank you very much for having me. It was a pleasure.
Thank you.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, They saw something was weird. My bulb was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I describe like an angel. I describe like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red one, that light red one. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIE KAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Welcome back to Doctors Are People Too. We have Dr. Nerea Lawson, a general surgeon, on the program. Dr. Lawson, how are you doing tonight?
I'm fine. Thank you very much.
Thank you. What types of general surgery do you perform?
Well, although I'm a trained general surgeon, I focus my practice in breast cancer surgery and thyroid surgery.
Now, thyroid surgery, I've actually had a family member recently had it, and I realize that it can be very complex. When is thyroid surgery needed?
Mostly thyroid surgery is done when a patient has a nodule and we either suspect or know that it could be a cancer. So we need to remove either part or all of the thyroid because of it. Those are the major reasons to require thyroid surgery. There's also a condition in which the thyroid enlarges very much. You get a goiter, and some goiters are very, very large, even extending down into the chest and down to near the heart area. And this puts a lot of compression on the windpipe and on the esophagus, and the patient has a difficulty, just plain old breathing and living a regular life. So we need to remove this very enlarged thyroid, not because it's malignant, but it's just causing a lot of pressure.
I see. We're here with Dr. Nerea Lawson, general surgeon on staff at Palmetto General Hospital, palmettogeneral.com. Now, are there different signs and symptoms that, maybe a family member or even an individual could notice for a thyroid-related disease or cancer?
Well, sure. The pathologies that affect the thyroid are mainly two. One of them is either the thyroid is functioning too much or too little. And hypothyroidism or underfunctioning thyroid is actually quite common. And both these, either too much functioning or too little, are taken care of usually with medication. And you replace the thyroid hormone that isn't being produced, or you give treatment to slow down the function of the thyroid. On the other side of the spectrum, it's you have to determine if a thyroid has a nodule, and then you need to test it to see if the patient could potentially have a cancer. And thyroid cancer is a very common malignancy. We see it a lot. The most frequent type tends to be quite survivable. If we catch it early and we do the right operation and the right treatment afterwards, most patients can survive this cancer. There are, of course, some more serious cancers that no matter what you do, you're not really going to be able to help the patients. And these are fortunately rare.
I see. What typical age group is affected by these types of thyroid cancers and diseases that may require, I guess, a surgery or follow-up or even medication? What's that age group?
Well, the hypo or under-functioning thyroid, we see it on all age groups. Women tend to be more affected with problems of the thyroid. Of course, it affects men too, but it tends to more occur in women than men. Even cancers of the thyroid occur more in women than in men. So it can really happen at any age. There's no real age in which you're out of the risk. We have patients that we've operated for a thyroid cancer who are in their early 20s, and even in their teens, we've seen that. Sure.
I'm glad you shared that with us, because I would have thought it would have been for an older person, but it's important to people need to be going to their doctors and regularly, because it can the doctor just said it. Dr. Lawson, that it can, affect people as young as in their 20s. Now with early checkups, regular blood work, is that some of the ways that a primary care physician would monitor the thyroid before it became an issue and they'd have to visit you as a general surgeon?
Yes. In terms of the function, if the patient has symptoms of low-functioning thyroid or hyper-functioning thyroid, and a sluggish thyroid is, of course, you're putting on weight, you feel cold, your skin is very dry, the patient's constipated, the hair is thin and falling. On the other hand, if the thyroid is functioning too much, the patient is very excitable and very nervous and, very hypermetabolic. And when you suspect that, it's a simple blood test that will tell you the levels of the hormone of the thyroid in blood and whether you're producing enough or not enough. On the other side, with the nodules, the primary care doctors and the family practitioners, when they examine a patient, they usually will examine the neck for any lumps or any masses. You can also find these with an ultrasound of the thyroid. And many patients do get ultrasounds of the thyroid. It's a very cost-effective, very simple procedure. There's no radiation, but you can take a much better look and much more objective exam of the thyroid than just palpating it. And if they do see those nodules, they will refer the patient to have a biopsy, which is the best thing that we can do to assess whether that nodule is risky or not. And the biopsy is done by the thyroid surgeon, and sometimes it's done by the radiologist. We do it guiding ourselves with ultrasound. You do an ultrasound, you find where it is, you numb the patient, and with a little needle you take some tissue out to look under the microscope and see what it is that the nodule is composed of.
And we're here with Dr. Nerea Lawson, general surgeon at Palmetto General Hospital. That's palmettogeneral.com if you want to type it in your browser. Number is 305-823-5000. That's 305-823-5000. Palmetto General Hospital is located at 2001 West 68th Street in Hialeah in Miami-Dade County. And Dr. Lawson is also bilingual in English and Spanish. Now, Dr. Lawson, you mentioned another one of your areas of interest is in breast surgery for breast cancer. When is breast surgery necessary, and what types of breast surgery do you offer at Palmetto General Hospital there?
Well, in America, when a woman has a finding, either because she palpates a mass or because there is some finding on her mammogram, and this needs to be studied, in America, the ringmaster of all this is the breast surgeon. So the patient is first referred to us to work up whether this is something that is benign, that it's nothing that we need to follow or even worry about, or if it's something that we do need to follow, or even worse, if it's something serious and we need to do a biopsy and see if it's something bad. So the first step when a patient feels a mass or gets a mammogram that has a finding is they come to the breast surgeon, someone like me who has an interest in breast cancer. From there, we sometimes do some other imaging to take a better look as to assess better whether this finding is something that needs to be studied. The default test is to do a little biopsy of the nodule or the area or the cluster of calcification seen on a mammogram so that we can see what we're dealing with. The vast majority of findings on a mammogram, the vast majority of masses that a woman feels are not going to be cancer. And we need your audience to understand that even though they panic and they come in quaking in their boots in my office, I have to let them know that over 80% of these are not going to be anything to worry about. But we need to be 100% sure.
Well, that's definitely good news. Definitely, because, over 80% may not be anything, but still need to get checked out. That's important. What is the most rewarding thing about being a general surgeon?
I will have to tell you that most of the problems a patient walks in to see me with, I can take care of and almost always make it go away. Whether it's they have gallstones or they have an appendicitis, or even if they have a cancer in the breast, I can go in, take it out, treat them, and that's it. Go home. You're done. Chances are good you're going to do very well. As opposed to having somebody with a chronic disease that you have to give medication and follow and treat, and for years and years, and you just never, the patient says, well, but you just can't cure them of that. It's really rewarding to just step in and take care of things effectively.
Dr. Nerea Lawson, thank you so much. Dr. Lawson is general surgeon at Palmetto General Hospital. Website is palmettogeneral.com. Number's 305-823-5000. Located there in Hialeah. Dr. Lawson, thank you so much for coming on Doctors Are People Too.
Sure. Thank you for having me.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions